You may think healthcare happens in clinics and hospitals, but social determinants of health shape our well-being long before a doctor is ever involved. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that influence health, functioning, and quality of life outcomes and risks. These factors are not personal choices. They are the environments that shape every choice. Researchers group social determinants of health into 5 areas: economic stability, education access, healthcare access, neighborhood and built environment, and social and community context. Economic instability forces families to choose between paying rent or buying life-saving medications. Underfunded schools and low health literacy leave people unable to navigate insurance forms or understand medical advice. Insurance gaps, provider shortages, high out-of-pocket costs, and language barriers put routine care out of reach. Neighborhoods with food deserts, polluted air, and crumbling housing create environments where disease thrives. Discrimination, violence, and social isolation add chronic stress that erodes both mental and physical health. Imagine waking up in a rural county with no hospital within 50 miles and relying on a weekly mobile clinic to manage chronic conditions. Picture a parent juggling 3 part-time jobs who cannot afford both rent and insulin for their child's diabetes. Envision a city block where no grocery store sells fresh produce and a single pharmacy stocks expired medicines. Feel the anxiety of a non-English speaker trying to schedule a mammogram without an interpreter. Consider the stress of a home health aide working without paid sick leave who must report to work even when ill. These cumulative barriers push many people into emergency rooms for conditions that could have been prevented. In Chicago, a city campaign now aims to close an 11.4-year life expectancy gap between Black residents and their non-Black peers by tackling economics, housing, and healthcare access. A Black mother in the United States remains 3 times more likely to die in childbirth than a white mother, driven by unequal care, chronic stress, and implicit bias. Children living in moldy, pest-infested apartments near busy highways suffer asthma rates far above the national average. Each layer of disadvantage, from language barriers to surprise medical bills, stacks up against marginalized communities. If we truly want health equity, we must dismantle these upstream barriers rather than just treat symptoms. That means expanding Medicaid, utilizing telehealth visits for remote towns, and funding sliding-scale clinics. It means investing in quality schools, safe housing, reliable transit, and clean water systems. It means building social support networks, fighting discrimination, and ensuring every patient finds a provider who understands them. Public health professionals must partner across sectors, education, housing, transportation, justice, to improve every environment where health can flourish. Because the zip code you're born in should never determine whether you live a long, healthy life.